folks. Thanks for coming. Hopefully you guys are having a great meeting. We're going to talk to you a little bit about technology workflow and services. Personally, as the CEO of Annexus Health and co-founder, I consider myself an advocate at heart, and it's really what led me to do what we do at Annexus Health. So, Joe Buffone, co-founder at Annexus Health, one of my partners, Sophia Tisdale, runs our services division at Adparo. We're going to be spending some time talking today about what's the best way for patient assistance to be delivered to the patient through the provider in the complex ologies, specialty space. So as advocates, why are we here? Well, I hope you're here for the same reason that I am. I'm here to provide the ability for myself to do something meaningful, take meaningful action on behalf of patients. So whatever your definition is, we're here to learn, but I hope we're here all to figure out a way by communicating and learning from others how we can actually truly make an impact on patients. So at Annexus Health, our focus on meaningful action for advocacy is tied to building technology, optimizing workflow, and providing expert services to assist with delivering and the fulfillment of patient assistance. So that's what we want to talk to you guys today about. We're always in learning mode, as we all should be. And so what we're going to talk to you today about is some information that we gleaned from a survey we did in collaboration with the health advocate folks. We'll talk to you a little bit about our company. We'll talk to you a little bit about the services that we provide, and then spend some time on some Q&A if you guys have any. So the survey we did in collaboration with health advocates made up about 105 folks that were at healthcare organizations, and we asked them questions about the elements of how does patient assistance, copay assistance, and other assistance get to patients, the patients that they serve. So we asked them questions about the challenges and the solutions that they see and need in the space. So we're not going to go through the entire survey, but a couple things that we pulled out from it were very interesting. So anyone that plays an active role or understands the fragmented, disparate nature of financial assistance probably isn't surprised by what you see on the right-hand side, that there's a bunch of different tools that are used to manage financial assistance. So when we're talking about specialty space, these complex ologies, the providers are managing the assistance. They're using spreadsheets, they're using Post-it notes, they're using fax machines. There is more software, there is more technology in the space, but there's a really telling piece of information on the bottom left that shows that almost half of the folks that are working with patients around financial assistance are using other tools. So these tools that probably should be retired along with their technology. And I think that's a statement of what's available in the space right now. It may not be comprehensive in nature. I think in the environment and where we live, it's very app-based, right? So an app for this, an app for that, and it feels like often it's not comprehensive the way we approach things. I don't do social media, but think about social media. There was the prior session, someone was confusing Snapchat with whatever's used here for the slides, but there's Snapchat, there's Instagram, there's whatever, right? And I don't use any of it, but it's all siloed and separate. So even without technology or with technology, there's separation and not comprehensive approaches to the management of financial assistance, which creates a really broken way. So the respondents weighed in on some of the things that were heavy or moderate related to managing financial assistance or patient assistance for patients. And anyone that does the work or is associated with the work understands that let's talk about a patient that is functionally uninsured, that's a Medicare patient, that doesn't have a secondary, doesn't have a great secondary. There is a constant need, if patients need help, and you don't want them to go on free drug, to constantly be looking all the time where assistance possibly is available. And these charitable foundations are wonderful, but the funds open and close all the time, so it's super arduous to manage that. On the commercially insured side, manufacturer programs are so amazing, but they're all manufacturer-facing, product-specific. So there's a lot of work associated with just managing all of the different portals. Headcount. One of the things that we're going to talk about is our services division, and it really was why we stepped in to services beyond technology and really positioned ourselves as our company as a tech-enabled services company, because there just isn't the headcount, the economics to be able to do that and support that from a provider perspective, or the just qualified folks in the space to really understand all components of what's available for financial assistance and patient assistance. One of the other things from a technology perspective is connectivity is a problem. So if you're using technology and that technology isn't connected in the provider practice to their EHR, to their rev cycle, to their in-office dispensing pharmacy, often there's going to be duplicate work. It's going to be very manual. So connectivity to existing systems is really important, and it's obviously a problem in the space. And then if you don't have a system or a technology that allows for the comprehensive nature, the cycle management of financial assistance, then you're not going to be able to have the information necessary to produce analytics. The analytics to allow you to know, as a provider organization serving patients, where you stand at any given time. So a little bit about Annexus Health. I mentioned advocacy is at our heart, equities of care, removing disparities. And my co-founder and I started with a very big vision and really honed in on financial assistance, but we have big plans of expansion. So the big vision was to attack administrative and logistical challenges related to healthcare. So I mentioned 3 systems that we connect with at Annexus Health, the EHR, the rev cycle, and the in-office dispensing software. Those systems are meant for specific things. They're not meant to manage the administrative logistics, the central air traffic control needed for financial assistance, for the cell and gene space, for the testing and diagnostic space, for the patients that are on orals, and the nature of their care is remote. So our big vision is to provide an enterprise platform to provider organizations, healthcare organizations, to manage specific administrative logistics. So our next iteration as a technology company is to launch an eventing, a work list, a tasking system that gives us the ability to house work list and task things like benefit verifications, prior authorizations that are all a really important part of making sure patients are whole in their care so that they don't run into financial situations or situations where ultimately services aren't getting to them because of the administrative and logistical burden that sits at the provider organization. So our mission as an organization is to do 3 things, and it's 3 things that are focused on the patient. I believe in healthcare. I believe that there's a better way to do healthcare, but I, by and large, believe in the U.S. healthcare system, options, the wonderful therapeutics and care that's available. So we every day pour into improving the likelihood of patients getting on therapy where there's an intention to treat. Speed to therapy, that often in complex specialties is a real problem, delay of therapy. And then also duration, so getting therapy into patients as it's planned. Believe it or not, administrative logistics, financial issues, as you guys all know, play a massive role in making these things much more difficult than they need to be. So as an organization, we provide technology assist point. It's technology that's licensed to the provider to manage the comprehensive nature. We call it financial assistance cycle management, and there really is a rev cycle component to that needs to be managed wholly and completely at the provider level. So we define it as search, enroll, track, and analyze. That's just the way of saying we're going to find patient assistance as a payer. We're going to find that assistance. We're going to make sure that patients get enrolled in it. But we do a lot of back-end work with our connectivity with the systems that make sure it's utilized. And that's a really important part. When we were building this company, we were looking at data, and we were incredibly surprised at the percentage of patients where a copay award is accessed, but it's not utilized. And it's because it's really complex. The submission of claims, the posting of payments, so the billing and reimbursement is a mess, and those are the things that we're attacking wholly and completely as a company. But as we launched our technology, we found that it was difficult to just change workflow and perspectives, so we partnered with provider organizations, and then we launched Adparo. And so our folks are really expert in the workflow required to manage financial assistance, other assistance options wholly and completely, and that's Adparo. And that's our staff that goes in, uses our tech and our tooling to manage this for providers on behalf of the patient. So getting back to the survey, some of the things that we provide as an organization are listed here, and we asked the participants to rank these things, and they put them at the top of the list. This isn't everything that we do as an organization, but identifying available assistance, making sure that during the re-enrollment period, that's a really difficult time for providers to manage. The automatic re-enrollment process that we have is really important. The automatic notifications around fund status, as I mentioned earlier, the charitable foundation world, it's crazy the challenges that exist with getting funds in some of these disease states. Making sure that we're tracking patients really closely when funding becomes available so that they get enrolled in these programs. Pre-populated enrollment processes that just make for a quicker, easier way of getting patients enrolled into programs. Our work, when we are engaged with life sciences or charitable foundations, the turnaround time on an application to enrollment is 3 to 5 seconds. That's not the typical way that things happen. The analytics I mentioned that exist from our platform give a real, true, deep understanding of what's going on by a patient level, at the global level, by assistance level. We give the ability to provide and include local assistance. The tasking and assignment mechanisms make for a cleaner workflow. And then the collection of signatures. Consent is one of the more difficult things that exist around these programs in this space. And so we're constantly iterating and learning, right? We're talking to our customers all the time. We're talking to the folks in the space all the time to figure out the best way to do that. So we're just now launching a DocuSign feature to eliminate some of the struggles that exist with that. And then just the support that we provide, the training, the experience that we have is something that is valuable as a partner to really advocate and help patients get to where they need to be with their care. So I don't know how, I wasn't keeping track of time. Did I do all right for you, Sophia? I kept it right at like 14 minutes, I see. As we transition, I had eye surgery a couple weeks ago, so I don't know if I read any of the words wrong. I don't know how that all sounded, but I can't see anything on my screen if you think that I was reading from my screen.
Thank you. So just like Joe mentioned, my name's Sophia, and I run the services division at Adparo at Annexus Health. And so thanks again for joining us. But ultimately, what we really wanted to share with you guys is what we do within Annexus Health. We have an amazing software platform, and our administrative team, our Adparo team, gets to use that platform. So we're going to talk a little bit about how our Adparo team does it today, and would love to connect with some of you guys on it. So, of course, what Adparo does, just like you guys, each of you in here in this room, is probably an advocate for yourself, your family, your patients. We utilize our tools. So just like we talked about Assist Point, it's very, very important to have a tool. All these sessions that I've gone to, a lot of them speak of different tools. I remember working at a practice, and we had spreadsheets and manila folders that I remember whiting out to recycle for another patient, and that's what we did. We've got an amazing tool called Assist Point, and that's able to help track, manage, and execute all of your patient financial needs. But with that, not only do we have an amazing tool, but we have a pretty awesome staff. All of our staff is mostly financial counselors. They're office managers, they're pharmacy techs that manage all of this. So ultimately, that makes it a pretty good package for us and our services. Now, what we typically do is we offer these core services. What does that mean? Core is basically getting down to what our services offer. If you typically take a patient's day, patient comes in, they get checked in, they have their insurance verified via multiple tools. Some people use different tools. Some people call the payers. Some people use different portals. They get checked in, and basically a provider places an order. So they do their exam, and sometimes they'll place an order, and they'll want to start the treatment on the same day, right? That's usually our fun part, where they don't want to wait 72 hours because physician, they want to take care of their patients. Typically, we have our fun field where we have to go and do a benefit verification and a prior authorizations. We all know, whether we're in the medical, clinical side of things or on the pharmacy side of things, prior authorizations are becoming more and more common for us. That is unfortunately one thing we can't get away from. But with that being said, while that prior authorization is going on or that benefit verification, you can go ahead and identify what funding does the patient need. Do they need a copay assistance? Do they need free drug? What do they need? That way, when you're able to do a cost estimate for a patient, you're able to see that not only is a patient required to pay their $2,000 deductible, but we're able to get them a copay card for one of the pharma companies or a foundation program. And then that way, the patient can start treatment in peace, and they know that they're not responsible for the $2,000, but yet only that $25 or $35. That way, the patient can get the treatment in peace. Claims are created, and then what happens? Majority of our practices that we speak with today, when we go through our typical sales cycle, this is the biggest thing we hear, is that they don't have staff to enroll patients on the front end. But they do when the patient calls and yells and says, "Why did I get a bill for $2,000? So that's what we're trying to prevent. We want these patients to be worked up on the front end. But with that being said, another common thing that we do, some of our practices are here, where we've got some data insights within Assist Point that helps to identify, hey, we got this patient a copay card. Now they've got a claim that came through, and we need to go ahead and get a payment on file. So we make sure, our Adparo team does, and we've got tools within Assist Point to be able to say, hey, go ahead and file that claim so that the patient can get that, take advantage of that. Because otherwise, that grant is going to expire, the copay card's just gonna sit there, and the patient is having to pay for it. A lot of patients are now paying $5, $50, and setting up monthly payment plans. Eventually, someone remembers, hey, I got this letter from that grant that said it was gonna cover it, but sometimes it's a little too late. So with that being said, and this is one of our larger practices that we have within our network called American Oncology Network, AON. You may have heard of them. Aon has been utilizing Adparo since 2022. When we looked at their numbers and we said, what has Adparo done for them? What has this proactive approach done for them? When we looked at it in around November 2022, they had close to $54 million of secured awards. Now, we had been live with them since about April, so $54 million, that's pretty good, that's pretty awesome. But when we looked back and said, okay, let's look at November 2023, we increased their awards by 117%. That means we were able to secure over $117 million of awards. Now again, that's a huge amount of patient advocacy that our Adparo team, using our platform Assist Point, did for these patients. Without our software, we'd be Googling, we'd be looking, we'd be talking to every FRM that possibly could walk in through the door, and that's what we want to provide. We want to be able to provide that tool at your fingertip so you're able to help your patients, because we want these numbers for you, whether that be through Adparo or whether that be through Annexus Health using our portal. So ultimately, we really hope that using our services, using our platform, you're able to see your homegrown tools are amazing and they are going to continue to help, but there's an easier way where we can help you with Assist Point to be able to guide and track all of your patients. So I'm going to pause there. Joe, I don't know if you have anything else to add before we go to Q&A? Yeah, turn.
Can you turn on the mic? How's that? There you go.
Yes.
I think that those that don't work at a provider organization, one of the things that you can do as advocates is talk to the folks that you work with and suggest that they talk to their provider organizations around tooling up to support them individually, but more importantly, the others that maybe are in their advocacy group, because there are options available. We believe that Annexus Health provides the most significant, comprehensive, connected solution, but we're in this for the patient. And so whether it's Annexus Health or another organization, there are tools available to make us better at finding assistance for patients. And that's a really important part of healthcare. It is the center of what we do at Annexus Health. So we'd love the opportunity if there's introductions that you want to make. We are in this for the patient, so we'd love to do it with you all.
Yeah, do you guys have any questions, any challenges that you run into? Yeah, I think we've got a question. Hold on.
Thank you. I was just curious if y'all run into any of those alternative funding plans, like the Pruda RXs and things like that, and how do you navigate that as well with your team?
So that's something that we're trying to work through and figure out. We've just launched, one of the things that I forgot to say and maybe brag a little bit about, the size of our network. We started in oncology, so we've got over 50% of the oncology space right now because of recent contracts that we've signed. We've exploded into the infusion space. We've exploded into the health systems space. So we cover 14 different disease states. And we've also launched into specialty pharmacies. So we have some really big specialty pharmacies. So as we learn and grow, we got really good at manufacturer assistance. We got really good at managing the complexity of charitable foundations. So now we're seeking to learn more to determine how we can add to what we offer. So love to talk to you afterwards on some suggestions you may have.
Any other questions?
Kathy's getting her steps in.
Okay, how are you integrating into the EHR systems?
So you're asking the question because you know how hard it is, right? So one of the things that we've done as an organization is taken an approach that in everything we do, we try to be agnostic. So our preferred way to connect is through APIs. But I don't know that we have an EHR API connection. I think that we have a lot of CRM API connections. We API connect with hubs. So typically it's an HL7. Typically it's a flat file download nightly, and then our data team is just working around the clock with tech to support that so that the data we're ingesting is real time. Great question, but you know how complicated it is, right?
Okay, so you said the claims are submitted, and how are the claims submitted?
So do you want current state or future state?
Current.
So current state, that's always the way to answer. The current state is that it's still the same. Right? So you got to submit the claims through the portal. You have to receive it at the fax machine, wherever it's coming in, right?
Yes.
The remittance. And then folks have to enter the information into a SysPoint if they're not using our services division. So the beauty of what's going on in our company right now is we have people that are doing all that. We're submitting the claims, we're posting the remittance, but we're not going to survive forever if we don't automate that. So right now we're actually building a clearinghouse approach to financial assistance adjudication, and we will have the claims submission and processing that will feed the rev cycle. Specifically the complexity on the medical side. The pharmacy side's a little easier,
Yeah.
a lot easier.
Yes.
Yeah. But on the medical side, that's what we're building right now. We actually launched a demonstration with a large manufacturer, and just to show you the results or to describe the results, one view of it is when we stepped into it, we saw that it was, and this is ridiculous, it was 45 days for an adjudication of a copay. Like that just shouldn't happen, right? It's not like a traditional payer. There isn't the complexities, there isn't the delays, but it's just cumbersome, right? There's a lot of connecting of the dots. So when we launched our electronic within network solution, and we were demonstrating it with specific provider groups, we went from 45 days to 4 days. So that's what we're building right now. That's and we're working with some charitable foundations on that as well. So we plan to be the clearinghouse and processing engine for financial assistance moving forward.
One more.
I love it.
So you said you made sure the claims were posted. Is that the same process as when you submit? Is that like a manual type process now?
Posting of financial assistance payments.
Yeah, today that is part of that same process because unfortunately, every pharma company, every life science company wants to make it better than the next, right? And so that's where I think some of the challenges comes in. That's where our tech company works to kind of develop and say, how can we make it seamless so that providers and patients don't notice it? Bottom line is, we got an award, we need to make sure that money's posted on your account. So ultimately today, there is that human aspect of it, but that's what we're building within our AP claim system to easily get that money directly all through one channel. And that way the money's there, it's easily there. But unfortunately, because there are multiple practice management systems, you're having to post it manually and making sure it balances ultimately at your month end. So, thank you. Those were great questions.
In the earlier session, they pointed out the complexities with the financial assistance application process, particularly in reference to literacy issues for patients. Does your software kind of help alleviate some of those issues as well as simplify the process?
That's a great question. And it actually was one of the foundational elements that we were looking to solve for with our technology. We aren't patient-facing at this time. Well, I take that back because there are definitely patient-facing components of this, like the consent, right? That's an issue. So we will continue to iterate and learn around what does it look like to include the patient. But especially in the complex specialties that we exist and we serve, it needs to be provided through the provider. It needs to be supported through the provider to optimize it. So ultimately, what's the question? I so impressed myself talking about what we're doing. What was your question? I'm sorry.
Complexity of patient.
Oh, the complexity of the application process, yeah.
Help
So,
simplifying it.
those that have been around, and you can tell I've been around too long, I'm losing my mind a little bit. There were a number of swing and misses at trying to unify the industry around an application process, and I grew up in pharma, so it was funny watching that happen, right? Trying to get people within manufacturer organizations to agree on something, right? Like, we're gonna use one form across different disease states. That doesn't even happen, right? So we went at it from a different perspective. So we created a 9-tab experience that consumes any requirement of any manufacturer program or any charitable foundation. So what the system looks like is you've got to answer all these questions. You have to have all of this information, the patient demographics, consent, whatever it may be, and that's how it's processed. Now it spits out, right, with our life science relationships, and we have a lot of life science relationships to create the automation. It spits back to them in the form that they need. And it's an API setup, but it's just the fields that they need. So that's how we solve for it. But great insight, that was a big part of the problem.
Anybody else?
Thanks, guys. Great questions. And thanks for coming. Good
Thanks,
luck with everything you
everybody.
guys do.